This is Claire with Boss Lady Beauty Academy, bringing you Chapter 11 from your Milady textbook, Hair Removal. This course is going to be good for all cosmetologists. It is everything you need to know when it comes to the hair removal theory chapter. So, if you'd be so kind, grab your pen and paper for notes or your tablet, whatever you're going to take notes on, and let's dive right into it. So, hair removal, chapter 11. Our learning objectives are fairly simple. We've got a few. We are going to explain the importance of hair removal, describe the structure of hair, explain the hair growth cycle, identify the causes of excessive hair growth, something nobody wants, compare temporary and permanent hair removal and reduction methods, emphasis on removal versus reduction methods. We're going to explain when to use hard and soft wax methods of hair removal. We're going to provide a thorough client consultation for hair removal services. We're going to list the items needed in a wax treatment room, and we're going to demonstrate waxing head to toe with soft and hard waxes. So before we go any further, I do want to say that there is a follow-up video to this for the hands-on demo theory portion that is a separate video. It's got its own slideshow, and essentially we talk about what you need in the room, hard wax, soft, the contraindications. We go into a little more detail for that. And then there is another series of videos strictly showing the actual process of applying and removing both hard and soft wax. So this is not a conclusive video. It's more of a series. Once we get through to it, then you'll be, you've seen all of them. You'll be much more confident with the hair removal process. No matter what your specialty is, everyone should be confident as a licensed cosmetologist, esthetician, cosmo, barber to perform waxing services. Hair removal is a popular beauty treatment that lots of clients are going to want to receive in the industry. And these clients are going to range in ages, they're going to range from male to female, and they're going to range in what areas they like removed and what methods they like that removal done. So, as a beauty professional, it's your job to understand the importance of hair removal and who can benefit from it. So it's growing in popularity always. It is never going to be clients available for you to perform hair removal on. Waxing is a common method of hair removal, but like I said, we're going to talk about other methods ranging from tweezing to advanced techniques that require special training like electrolysis, laser, and IPL treatments. We're going to understand the benefits, risk, and how to perform basic hair removal techniques. We're going to know our room preparation, safety, and infection control procedures. So, as an esthetician, as a cosmetologist, as someone who is going to be performing hair and removal, it's important that you study and have a thorough understanding of hair removal. Its growth and popularity really makes it a very beneficial service to provide. It's effort needed to provide it and the supplies needed to provide it are fairly simple. And because of those things, it's a very good business opportunity. And again, because it's consistently growing in popularity, you're constantly getting new clientele coming of age to get the service. It's always going to be in demand. So let's look here at the structure of the hair. So in this one, we are going to just take a second to look at the structure as a whole. The components that make up the hair, make up the follicle. You've got the erector pili muscles, you've got the hair shaft, you've got the sebaceous or oil glands, you've got the hair follicle, you've got the root, the hair papilla, and the dermal blood vessels. It's also broken down where you see the process or where you see the anatomy within the layers of the skin. So the epidermis or our office, the top layer, the dermis underneath the epidermis, that true skin, that live skin, and then the subcutaneous layer or the fatty layer. This is where most of the actions are taking place and slowly going from the subcutaneous all the way up to the epidermis until the hair is eventually shed off. So let's look at the structure of the hair. First, it's important to understand that the scientific study of hair and its diseases is called trichology. Understanding all aspects of the hair, including its structure, appendages, and types of hair found on the body, will help you suggest and provide the best hair removal services to your client. You have a hair follicle and all its appendages. The hair follicle is a mass of epidermal cells forming a small tube or canal that extends deep into the dermis. Within the dermis, you have the follicular canal, the hair root, the hair bulb, and the hair papilla. The follicular canal is lined with epidermal tissue, which produces the follicle and the hair matrix where cell mitosis happens. The hair root anchors the hair to the skin cells, and the root is part of the hair that lies within the follicle at its base. This is where the hair grows. You have the hair bulb, which is a thick cone-shaped structure made from epithelial cells that surround the papilla, forms the lower part of the follicle where the hair grows. The lower part of the bulb then fits over and covers the papilla. It contains the dividing cells of the matrix that produce the hair in both the external root sheath, and they are made up of horny epidermal tissue and internal root sheath. This is the innermost layer of the follicle. And then lastly, you have the hair papilla, which is a cone-shaped elevation of connective tissues that contain the capillaries and nerves located at the base of the follicle that will fit into the bulb itself. So this is necessary for hair growth and nourishment of the follicle. So the next set of structures we're going to talk about are going to be the hair follicle and the appendages, and then the types of hair. So we then have the hair shaft, which is the part of the hair that's located above the surface of the skin. Its keratinization is completed by the time these cells approach the skin surface, where the hair shaft protrudes from the skin. Basal cells in the hair matrix divide and form three main layers in the hair shaft. Those three layers are the cuticle, cortex, and medulla. The cuticle is the outermost layer. It's hard keratin. You have cuticle on the hair. It's also cuticle like in your nail beds and your nail beds of your toes. So cuticle, it's the outermost layer. It's hard keratin. You do have a cuticle of the actual hair. And then you have a cortex, which is the middle layer. It's also a hard keratin. And then you have the medulla, which is the center or innermost layer, which is the soft keratin. When it comes to the appendages, you also have glands. The sebaceous glands secrete the waxy substance sebum that lubricate the skin and hair, making it supple, waterproof, and protect against external factors. The erector pili muscle contracts when affected by cold or other stimuli, causing the follicle to stand erect. This is what's known as goosebumps. And although it keeps skin warmer by creating an air pocket under the upright hairs, it also helps disperse protective lipids from the sebaceous glands to the skin and hair. So when it comes to type of hair, you have three types of hair found all over the body, and that's lingo, or soft downy hair found on a fetus. This hair typically sheds after birth and is replaced with either vellus or terminal hair. Vellus hair, which is found in areas not covered by the larger, coarse terminal hair. So everywhere else that is not terminal hair is going to be vellus hair once you have been shed of the lingo hair. This is known as peach fuzz, and it's typically on women's cheeks. Could be a little bit of on the arms, forehead, the soft downy hair. It's not recommended to tweeze, shape, or wax because it can result in the follicle producing new terminal hairs, especially if removed against the new hair growth. So that's a little bit of a misnomer because technically the hair follicle is determined at birth. So it's going to be what it is. You can cause damage to the follicle by removing vellus hair, but it's very unlikely that you are going to change a follicle that produces vellus hair to terminal hair just from hair removal. That typically takes some hormonal changes as well. So I wouldn't be too worried about that process when talking about hair removal. And then you have terminal hair, which is the longer, coarse hair found on the neck, brows, lashes, genitals, arms, and legs. During puberty, the follicles change from producing vellus hairs to terminal hairs. And like I said, this hair is going to be determined by genetics, is going to be determined at birth, and it is going to have, its own process. That process is going to happen. So let's talk about some check-ins. So what are hair papillae and what are they necessary for? The hair papilla is located at the base of the follicle and it houses capillaries for nourishment and are essential to hair growth. The next question is, what is the benefit of the erector pili muscle? This muscle contracts, it warms fibers in the skin, which creates an air pocket under the upright hairs. It also helps disperse the protective lipids from the sebaceous glands to the skin and hair. We're going to skip this next check-in and let's go right into the hair growth cycle. So the hair growth cycle is the way in which, in the time frame that each of the phases of hair are happening. Those cycles can be determined and affected by multiple factors, including age, genetics, hormones, and a person's overall health, and even factors like prescription drugs. Anagen phase, catagen phase, and telogen phase are the three phases of hair growth. The anagen phase, or act, is the first phase, and it's where new hair is produced. The catagen phase, or the transition phase, C, is the phase in which the hair is transitioning and going into the T, telogen phase, which is the final arresting stage for hair growth. So now let's identify causes of excessive hair growth. So these are disorders and diseases that would potentially put your client at risk of having excessive hair growth on multiple areas of their body. The first one is going to be hypertrichosis, which is where terminal hairs in areas that normally form vellus hair. It's inherited. It is caused by other things like genetics and or environmental changes, natural life occurrences, medical procedures or treatments, and it can be treated aesthetically based on the simple fact that we can remove it. So there's nothing we can do medically, but as an esthetician, we can treat it by removing the excess hair. We may have to be a little more aggressive with our hair removal schedule, and we may have to use, a little bit of a more aggressive technique when it comes to the hair removal. We have to do more than one pass with hard wax, depending on where the hair is and if it's actually stubborn and not trying to be removed. But with hypertrichosis, I wanted to point out, as you can see here, it says it's excessive hair growth of terminal hair in areas of the body that normally only grow vellus hair. It's not necessarily in the adult male hair growth patterns. It can be genetic or ethnically inherited. So remember, a few slides back we talked about how removing hair at the anagen stage can risk the hair going from vellus to terminal. Well, hypertrichosis is terminal hair in areas that is normally vellus hair, so like the cheeks and the chin, the upper lip. In order for this to happen, it's an inherited or a genetic type of disorder, something that's happening in the body. It's not something that just happened because of hair removal. So, like I said, it's a little tricky to say that the risk of removing anagen hair, will cause vellus hair to turn into terminal hair. It's not 100% genuine, just simply for the fact that in order for that to actually happen, there has to be some inherited or some genetic things or some hormonal things going on. The next one is hirsutism, which is caused by excessive male androgens. It is excessive hair growth on the face, chest, underarms, groin, and especially in women. This is caused again by excessive male androgens in the blood. It may be caused by puberty, medications, illnesses, stress, and may be resolved by eliminating the cause of the condition. So if it's a uh, dietary factor, so let's say dairy's causing the problem or gluten, and I'm just making these up. But if that's the thing causing the hirsutism, then removing that would, help reduce the excessive male androgens going on. This can dissipate over time, and in women, the hair growth may be attributed to hormone imbalances and excessive androgen production secreted from the ovaries or adrenal glands, and even menopause. It may dissipate with time and medical attention. What I want to emphasize here is that the body keeps score. The body knows what to do, it knows when to do it, it knows how to do it. So, if something is not normal, there's typically an underlying factor. So don't discount a client coming in with, potential hirsutism or potential other disorders or diseases, hypertrichosis, and assume that's just what it is. Let the client know that this is not the normal process, and my recommendation as a professional would be for you to actually see, a physician. Which brings me to the next slide: hair growth and medical issues. So diseases, disorders, and syndromes. Diseases are pathological. They're like conditions caused by viruses and bacteria with a series of signs and symptoms. Diseases affect hair growth, acromonally, and crushing syndrome. Disorders are abnormalities of function, like a birth defect or genetically inherited malfunction. Disorders affecting hair growth or adrenal genital system syndrome, and it is a multifunction that causes overproduction of androgens. Then you have syndromes, like a group of symptoms that, when combined, characterize a disease or disorder. Syndromes affecting hair growth, most notably and prevalent syndrome, is polycystic ovarian syndrome, or PCOS. This is formerly known as Stein-Leviathan syndrome, and its another notable syndrome is Eckhart-Erich syndrome, and it's a combination of Cushing's and adrenal genital syndromes. So let's just say you have a client who comes in at 20 for waxing because at 18, 19, they start experiencing major hair growth differences, issues, excess undergrowth, whatever it may be, and they decide to get a wax as their first treatment as opposed to going straight to a physician. Well, if you notice any of these telltale factors of the excessive hair growth, hair growing in as terminal hair when it should be vellus hair in that area, then it's your professional responsibility to refer them to a physician so that they can be diagnosed with the appropriate thing or be cleared. We don't ever want to scare the client and make them think that they have something, but we do want to bring it to their attention that it's important to go ahead and seek medical attention. So let's get to temporary and permanent hair removal and reduction methods. Super excited because now we get to talk about the different methods that are actually available. So there are two general categories when it comes to hair removal: temporary and permanent. Temporary involves repeat treatment as hair grows. Think shaving, waxing, or in the technical term, depilation, epilation, depilation. So different types of temporary removal methods. And then you have permanent, which the papilla is destroyed, making regrowth nearly impossible. So, spa and salon techniques are generally limited to temporary methods, and some may offer electrolysis, which is a permanent method. There are some states that allow IPL laser hair removal that offer more of a permanent reduction, and then medical spas with physicians on staff offer laser and IPL hair removal, but rarely temporary methods. So, depending on the business and the brand that you're going into, it's going to dictate the type of removal method that you would use. So, temporary methods: home and professional depilation. Depilation is the process of removing hair at or near the level of skin. Think shaving or chemical depilation. Then you have epilation, which is the process of removing hair from the bottom of the follicle by breaking contact between the bulb and the papilla. This is tweezing, waxing, sugaring, and threading. So you're actually removing hair from the bottom of the follicle, breaking that bulb and papilla contact, and then depilation, which is shaving and or chemical. So physical or chemical depilation, hair removal methods. Temporary or tweezing. Tweezing methods use tweezers to pull hair out by the root one at a time. You have regular tweezing, which is manual, and then you have electronic tweezing, so electric tweezing. The pros to this is that it is cost effective to purchase the tweezers and it's convenient. It can be done, at any time. The cons is it's very uncomfortable. Um, Someone wearing eyeglasses or someone needing eyeglasses make it difficult. It's time consuming and laborious. It's only feasible in a small area, and the hair can be broken and create bumps or pimples. We do have a eyebrow tweezing protocol that offers a step-by-step that you'll see in another video. You then have temporary methods like shaving and chemical depilatory methods, or manual or chemical. So manual would be like the shaving, chemical would be like a nair. Hair is removed down to the skin surface with shaving, and it may appear that the hair is growing in thicker and darker as the fine tip of the shaft is what's actually being removed, making it so that when the hair grows out, the thicker part of the hair follicle, the hair, I can't think of the name of it, the thicker part of the hair itself is actually showing as it grows out, as opposed to the thinner tip of the hair, because you're shaving it off at the skin level. Shaving terminal hair on a woman's face could remove vellus hair, and repetitive shaving can stimulate terminal regrowth. Again, hormonal factors would need to take place as well for that to happen in conjunction. You want to make sure you use clean razors and do not shave so close that you cut the hair underneath the skin, and do not change direction of shaving. I'm going to say that again because it was kind of choppy. Make sure you use clean razors and do not shave so close that you cut the hair underneath the skin, or you cut the skin, and do not change the direction of shaving, because you can create micro tears in the skin and cause ingrown hairs. You then have chemical depilatory process, which is a chemical substance like a nair, is spread on the skin to dissolve the hair at the surface and just below the sternum corneum, so just below the top layer of the dead skin. The pros to shaving is it's inexpensive, convenient, fast, and for the most part painless. The cons is you will have stubble and you're removing hair only at the skin level, so it's very temporary. Like, it's going to grow back in 3 to 5 days depending on the client. The pros and cons to chemical hair removal is going to be also inexpensive, can be applied in the privacy of one's home, and regrowth can seem slower and softer because you're removing the hair at skin level and a little bit into the epidermis. And then the cons results not as long lasting as waxing. It has a strong odor. It can cause irritation and other reactions. And it really should not be used on non intact skin. So you're limited to where you can use it. And ultimately, prolonged use of chemical depilatory products will result in adverse reactions on the skin. So then you have threading, which is an ancient method of epilation that began in the Middle East and is rapidly spreading. It is also known as banding. It works by using cotton thread that is looped and twisted and then pulls the hair out from the skin. It is a faster, more efficient way to tweeze, essentially. Same pros and cons though. It's fast, inexpensive, you need minimal things to use it. It's hygienic because you're tossing the thread after each use. And it is a con because it can be painful. You can cause snags, you can cause micro tears in the skin. and it is can cause redness and irritation. Again, it's not as long lasting as a waxing, but it's more long lasting than a shaving because you are pulling it from the bowl. You then have sugaring as a temporary hair removal method. It's another ancient method dating back to the Egyptians, and it's alternative for to waxing for clients with more sensitive skin. You can use hand applied sugar or you can use stick applied sugar, so a sugar paste, or apply a warm sugar with a wax stick like you would apply wax. The product is held in the hand and applied against hair growth and removed in the direction of hair growth, and it's performed at body temperature if you're using a paste. Lots of pros and very few cons. So, some of the pros are you're not going to risk burning the client, not going to risk bruising. It's possible to work over areas that have psoriasis, eczema, varicose or spider veins, depending on the manufacturer's method of making the paste. You can go over areas more than once. It is safe to use on clients with diabetes. So when we talk about contraindications, you'll see diabetes is one. Waxing paste is safer for clients with that type of medical disorder or disease. The hair length only needs to be 1/16 of an inch as opposed to 1/8. No hair follicle distortion or breakage of the hair. Regrowth can seem lighter, softer, and less dense. It's naturally antiseptic because of the ingredients in the paste. It's hygienic because it's never reused on other clients, and there's no risk of double dipping. There's easy cleanup, and it's inexpensive if homemade. Cons: more time consuming than soft wax, especially on larger areas, and some minimal discomfort similar to waxing. It's not suitable for precise hair removal. Folliculitis and ingrown hairs are still possible. So, waxing, which we are going to take time to actually perform at the school level. So, you're going to learn waxing with hard and soft wax. And waxing is the primary method used by estheticians, cosmetologists, in the beauty industry. It can be applied in either a soft or hard form. Both of You have some that are made of resins and some as beeswax. You have honey wax with the added gum rosin in the most common, and wax is applied over hair and then removed. Hard wax is thicker and does not require fabric strips for removal like a soft wax would. The recommended time between waxing varies greatly, but generally 4 to 6 weeks. Depending on the client, you can go as quickly as 3 weeks to get them into a routine like you'll explore in our step by step. Pros of waxing: fast and efficient. Wax kits and products are available for home use, and it's inexpensive as a esthetician to purchase and begin. Speed waxing will cut service time, which is increasing profits. Shorter waxing time means minimal discomfort for the client, and regrowth is often softer depending on at which phase you remove the hair, and possible reduction in hair growth after multiple services because of potential damage to the hair bulb. Waxing cons: there's a lot of contraindications that we will discuss in the how to demo video. The wax can adhere to the skin and cause irritation. You can risk irritation and burning due to the overheating of the wax. You can lift the epidermal layer of the skin if the wax is too cool or too thick. Can be messy. The hair length needs to be 1/2 to 1/4 of an inch. Irregular growth can occur after multiple treatments because you're removing the hair at different levels. And poor technique can leave behind up to 30%, and you can cause breakage, leading to damage to the follicle and scarring, as well as ingrown hairs. I'm not going to spend too much time on electrolysis, but I do want to review each of them. There are three main modalities when it comes to electrolysis. It is a field of electrology, and if the state does not regulated, then you should be able to do it. But depending on the state, you may just need additional training or certification. The three main modalities are thermolysis, which is an alternating current to destroy the dermal papilla; galvanic electrolysis, which is a direct current to create a chemical reaction to decompose the follicle; and blend, which combines both methods applied alternatively or simultaneously. The electrolysis pros are it's the only method of permanent hair removal recognized by the FDA. Cons: costly, uncomfortable, not safe for all skin type. Treatments can cause redness, irritation, and swelling. Harder as a professional to get started in performing it, and you would have to stop all other forms of hair removal except for trimming and shaving in order to get it. So the waiting process can be a little bit burdensome. And then the last methods are the permanent hair removal and reduction via laser and intense pulse light, so IPL. These are defined only as permanent hair reduction per FDA, and both are normally performed in a medical setting under medical supervision. So, as an esthetician, it's not something that you can just jump into. There is additional training and additional settings in which you are going to want to perform it. Laser uses intense pulses of electromagnetic radiation that are attracted to and heat up the pigment. Intense pulse light produces quick flashes of light that shatters target without allowing heat to build up or burn the skin. Some of the pros to laser or IPL is fast, long-lasting hair reduction. Many produce some permanent results in hair reduction, and large body areas can be treated with greater speed. There's no risk of disease transmission from blood or bodily fluid, and it's not considered as uncomfortable as electrolysis. For laser IPL cons, you have a costly treatment ranging from 3 to 6 or more treatments, issues of long-term safety and effectiveness, so it's not studied for long-term safety and effectiveness. It's not effective on light and non-pigmented hair such as blonde, red, gray, or white. And depending on specific laser, it's generally not effective method on dark or tanned skin. So it's a very small window of people who can actually get laser and IPL treatments, making it potentially not worth the risk of getting it, and not the risk from the pain or the cost, but more so the risk of it actually not even being effective. So we're going to stop this part of the video here. We have gone through so far the methods of hair removal, permanent versus hair reduction. We've talked about waxing versus tweezing versus shaving. We've talked about the hair follicle, the structure of the hair. We've talked about some disorders and diseases, how to recognize them. And in the next section of this video, we're going to explain when to use hard and soft wax methods. So the rest of this theory, we will focus strictly on waxing. And then, like I said, after this theory, you'll move on to the demo theory. And then from there, you'll move on to each individual demo. So from here, we're going to move on to explain when to use hard and soft wax methods for hair removal. Hard wax and soft wax removal methods. The reality of it is that outside of a few rules, the method of the area that you decide to use hard versus soft wax is really going to be preference, as long as it's safe, sanitary, and effective. So in order to determine what makes using each wax product safe, sanitary, and effective is what it's typically designed to do and work for. So one of the most popular services in the salon and spa is waxing and hair removal. So for hard wax, you are using a no strip removal method, and it's generally for smaller areas of the body where hair grows in multiple directions. Versus soft wax uses a strip for removal, generally suited for larger areas of the body and hair that grows in a single direction. The formula is beeswax, paraffin wax, honey wax, and other wax substances that will allow the hair to be gripped and then attached to a medium and removed. There's waxes that are for more sensitive skin. There are waxes that have soothing or antiseptic benefits. Those are where the preferences lie. The consistencies will vary, as so will melting point. So if it's designed to be used cooler, if it's designed to be much hotter, if it's designed to be thinner or more liquidy or thicker, like a peanut butter or something that spreads a little better. It's important to keep the wax at the appropriate temperature to make it effective and optimal. You don't want to overheat or burn your wax because it will cause injury to the client if it goes on too hot. But you can also risk burning the wax to where it will no longer remove the hair. Regrowth is softer and there is no stubbly feeling when you are using the appropriate wax. And hair regrowth, if taken at the anagen phase, can take anywhere from 6 to 8 weeks to actually regrow in that particular area. I also want to note at this point that gloves must be worn for all waxing services at all times. There is never a situation where I'm going to perform a wax service without gloves. So let's talk about hard wax essentials. It can be a gentler option as opposed to using a soft wax, but it is strong and will allow for you to remove hair from any direction. It requires the same pre-treatment as soft wax, and the technique is more of a apply and swirl versus a clean, thin application. Hard waxes are available in blocks, disc, pellets, or beads. Generally, the harder the wax, the more heat is required to melt it, based on resin called rosin, and often combined with beeswax as well as candela or carabuna waxes to modify the melting point and provide more strength. Gentle enough for facial areas, yet strong enough to be used on coarse hair and area where growth covers multiple directions. I'm only using hard wax for Brazilian. I'm only using hard wax for facial waxing, except for eyebrow. The pre-treatment for hard wax is cleansing and preparing the skin, of course, removing all makeup for the treatment from the treatment area, and for larger areas, cleansing and generally using a general antiseptic is a faster and more economical way to provide hard wax service. It generally requires pre-wax oil to protect the skin depending on the wax you use. I like to work with a completely dry oil-free surface so that I have more grip on the hair to get more wax out. For the technique of hard wax, you're applying with an applicator at 45-degree angle to the skin in a thick layer that hardens as it cools. It's first applied against hair growth and back and forth figure eight patterns to ensure each hair is coated. You're going to then grip the wax at one end and pull while slightly tacky for some hard waxes versus fully set up for other hard waxes. The hard wax that you're using is going to dictate at what point you remove it. It can be removed in the direction or outside or in the opposite direction of hair growth, which is what makes hard wax essential for waxing in areas like Brazilians, underarms, the butt strip, and facial waxing because there's typically multiple hair growth directions and you don't want to use soft wax in areas where the hair grows in multiple directions. And it can be applied to an area for a second time during the same service. So unlike soft wax, you can do two and a cleanup strip with hard wax versus soft wax, you really need to stick to one removal and then a hard wax cleanup. Post care, so make sure you use post care treatment to remove any remaining wax and provide soothing aftercare products with chamomile, tea tree, or aloe vera. I also like to use a cold towel. I'm going to do some don'ts, and these are going to be don'ts for both hard and soft wax. So I'm going to do the don'ts after we go through soft wax as well. So soft wax, common method, roll-on wax, and pre-treatment. Soft waxes are one of the most common methods. It is predominantly made of rosins that adhere to the skin. Professional soft waxes have a lower melting point and typically come in a can. Some come in plastic bottles for single use clients with a roller head application. I want to emphasize the single use client. Its consistency is that of a honey, which, when melted, will apply and run down and around the hair. It can be removed immediately with muslin or pellet while still warm. What I like about soft wax is that if it does cool too much, you can warm it up with your hand on top of the melon or muslin. And what I like about hard wax is I can apply multiple areas of hard wax for like my cleanup and then remove them all at once. Remember that with soft wax, you want to make sure you are applying soft wax in the direction of hair growth and removing in the opposite direction of hair growth. The technique is to 1, test for correct and safe temperature. 2, using your applicator, apply a thin coating of wax in the direction of hair growth. Then use the edge of the applicator at a 45-degree angle across the area to thin it out and smooth it on. Then immediately place muslin or pellet over the area. Make sure there is a wax-free portion at the end of the strip. Warm the strip up with your hands. I like to do 2 to 3 swipes in the direction that I applied it. I'm going to hold the skin taut, and then I'm going to pull parallel to the skin in the opposite direction of the hair growth. You want to make sure once you've done that you apply a little bit of pressure with your gloved hand to stop any burning or stinging that the client may feel, and then remove from there. So I do want to go to our do's and don'ts of both soft and hard wax. So do's and don'ts. Always do check manufacturer recommendations. Don't guess. Get your product from a professional source, read the instructions, and use it in the way that is recommended. Always test the wax, prior to applying it to the client. Do make sure to check for contraindications. Make sure that it's safe for your client to receive waxing. Obtain a signed release. Always, 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 no matter what area you're waxing, wear gloves. Make sure you apply the wax in the proper direction. So let's recap that. For hard wax, you can apply in any direction and remove in any direction. Ideally, you want to apply in the direction of hair growth and remove in the opposite. But with hard wax, you can apply in any direction and focus on that swirl technique, which you'll see in the hands-on. For soft wax, you have to apply in the direction of hair growth and remove in the opposite direction, always. For don'ts, don't provide a service without consulting and obtaining a signed release. Don't provide a service to someone who is not of age or doesn't have all of their faculties to agree and consent to the service. Do not double dip your spatula. I'm going to say it again for the people in the back. Do not double dip your spatula. Do not use your spatula to touch the skin and then dip. Do not cross-contaminate. Do not let soft wax cool too much before removing it. It will bruise or lift the skin. Do not apply wax too hot, as it will burn the skin. And do not over wax an area. When I said that preferences are going to come into play, that's what I mean. So you can use soft wax on the Brazilian wax tech service if the hair grows in one direction. In my professional opinion, it's easier to use just hard wax for the whole service. But again, that's a preference. As long as it's safe, sanitary, and effective, then you're absolutely fine. And we know we're going to be safe because we're going to apply in the direction and remove in the opposite. And we know that the wax will be the right temperature. We know that we've gotten our consent. We know that we are not going to double dip. We know we're going to wear gloves. And we know that we're going to apply the appropriate wax medium for the client that needs it. And then let's see what else we need for this one. And that's it. So that's all we have for this section. Everything else is actually demonstrating the technique itself. So we're going to demonstrate for hard and soft wax. We're going to demonstrate for a full waxing service for each of the areas. So from here, what you would need to do is watch the next video in the series, which is essentially the, let's go all the way to the end, which is essentially the hands-on information. So we're learning what we're going to do, what we can't do, setting up the room, the contraindications, the step-by-steps. We'll go through each of the protocols, and then the videos following that are the videos of us actually performing the services, actually performing the techniques. So until then, I will see you in the next one.